So I'm pleased to introduce Dr. Robin Glaze. She's been a nurse for 34 years, graduated from a diploma nursing program, and most recently earned her DNP, focusing on leadership and population health. Nursing background includes medical, surgical, cardiac pulmonary care, PACU, clinical education specialist, and assistant professor for undergraduate nursing. She's been working as an educator for the past 12 years. She's board certified, professional nursing development. She currently works at Bon Secours Mercy Health as a nursing professional development manager. She's passionate about teaching and developing nurses to their full potential and assuring they have all the resources and support they need. So welcome, Dr. Glaze.
Oh, well, thank you. I am amazed by today's presentations and in awe of all you leaders who are here and the innovation that I've heard today. It's really been very inspiring. When I submitted my poster presentation, it's just a different focus because my focus has been on developing nurses. And at that time, I was teaching undergraduate nursing. And my focus is on helping nurses to apply their knowledge to think like a nurse and develop clinical judgment. So I was just going to present my poster of the work that I had done. I think I can share my screen here. Okay. So this is my poster presentation since we are in a poster presentation today. Can everybody see that? I can't hear anything, but I don't know if you can, if my screen's able to be.
Can you zoom in? Can you
I'm
zoom
sorry?
in? Can you zoom in?
I can. Can you see this? Can you see it though?
Yes.
I'll keep zooming. Okay.
Yes.
I'm going to minimize this. So the title of my project was Enhancing the Clinical Judgment of the Student Nurse. And, you know, you're thinking of, some people may wonder why this is needed, but being in education for the past several years, I'm working with students in the clinical setting who really may be doing very well in the classroom, but when they get into practice, they're really not pulling it all together. So I began, let me turn this down a little bit. So I began with my introduction just of what clinical judgment is and why nurses need to be able to make that clinical judgment to improve patient outcomes. But the definition really is that critical thinking along with clinical reasoning equals a nurse's ability to have a good clinical judgment. So there's different literature out there about, you know, sometimes people will interchange these definitions, but critical thinking is you're applying some knowledge, you act on what you know. But the clinical reasoning is that nurse understands the pathophysiology. She can filter that data, the lab data, all the things that are going out, that patient assessment data, and can reason as that patient's condition changes. And the outcome is that clinical judgment where they can make a decision whether to act or not. And that's a lot, this part here where that decision is made to act or not, is where a lot where that failure to rescue has come from in nursing. So let's go to background just about, and when you look at nursing education, that we are consistently challenged to prepare nurses for clinical practice with all the developments in technology and everything over the past many years. And we are challenged to develop teaching strategies to help our nurses and student nurses to think and to make decisions. Limited clinical time. They don't have enough time to really, that clinical judgment takes time and practice and patient care to develop. So that is very limited. And we look at the pandemic and how many of our student nurses weren't even able to go to clinical, and different things had changed. It's a whole other topic of how our learning methods changed during COVID. But this was actually happened prior to COVID. And then as I was doing this, COVID happened. Okay, students need more time to cultivate those decision-making skills and aid their transition to the role of the nurse. And I used simulation, and the reason for that was to replicate those clinical experiences and increase their ability to connect theory to actual clinical practice. And we needed to explore the most effective methods of how we educate our nurses so we can produce safe graduates and have good patient outcomes. It was really pretty alarming when I look at this significance here. Sorry, I'm trying to zoom in here. That new graduates, literature showing that they are not prepared to transition to the role of professional nurse, and only 23% of these nurses meet that entry level expectation. These are based on some really impressive research studies. Looking at the errors and failure to rescue, 65% of errors could be prevented if nurses had the skills to make those appropriate decisions. And that failure to rescue and not responding and not intervening in the amount of time necessary to help a patient is related to that nurse's inexperience or lack of knowledge. So let's go to the other part of my poster here. I've never done a poster presentation like this. This is my first. So, okay. So I did a mixed method comparison. It was actually a cohort QI project. We implemented simulation, and the big thing here is we use the standards, the international standards of best practice. Use the Jeffries simulation framework, which is also the National League of Nursing framework for simulation. Did measurement of knowledge, did a pre-test, post-test, and also we're able to measure clinical judgment with the last sort of clinical judgment rubric based off of Tanner's clinical judgment model also. So the diagram here is just the NLN and Jeffries simulation framework. And when you're looking at doing a simulation, it really how it's set up and knowing what the objectives are and the outcomes is really important to meeting the outcomes. And you have to look at the different factors of who's facilitating it, what are your participants like, how are the educational practices being delivered, and then also look at the type of simulation that is needed, because sometimes a high fidelity simulation isn't really all that's necessary. Sometimes a simple case study can be, it's a low fidelity, can really get the critical thinking and get them to think through the situation. And it really just depends on that and what is your outcome of that. And so you look at all those factors and determine your outcome. And for the purpose of that was to develop that clinical judgment. Just reviewing Tanner's clinical judgment model. I'll make it a little bigger. 4 steps. This is kind of the baseline of the theoretical development of my project, but noticing changes in the patient where the nurse can recognize relative data and potential complications. But can they interpret that? Can they understand the pathophysiology of what's going on? Do they know what the meaning is of the data that they're seeing, the patterns, and do they know why this is happening with their patient? And then the response. This is really the critical part. Are they correlating that data appropriately? Are they making a plan of care? Are they intervening with the priorities? Because this is where that failure to rescue occurs. And then the final part of the model is just about looking at the outcomes and thinking about while you're in the action, while they're in taking care of the patient and reflecting on what they're doing, how the patient's responding, and evaluating, and then moving on, making other decisions. Is included with that. So the purpose of my whole project was design a program to enhance that clinical judgment ability of the undergraduate student nurses. And where I was doing the study at the university, simulation really wasn't being used with the best practice standards. So we took those standards and really incorporated that into this project. To do it under a really structured format to be able to enhance that clinical judgment. So that was the overall goal there. Let me move over here. Going back up, sorry, my screen, I'm just going back on my poster here. Okay, so I found the whole project was, we did the simulation. The students went to had lecture on the heart failure, which actually I was a theory teacher, and I taught them, everybody went through the same lecture, and they had a pre-simulation test. And the pre-simulation test, everyone participated in, and this was all done online via jot form, and it was anonymous. And then they went to simulation, and then they were able to take that same test, same questions with a post-simulation. And the goal of my hypothesis was they would do much better after the simulation than beforehand, because it would be really to reinforce the knowledge that they learned in the classroom. What you're seeing here, there's 10 questions, and each question kind of differentiated what part of your was a nursing action they had to take, was identifying symptoms, was it knowledge on diagnostics, so different things. So I categorized all that. But when you look at the results, you'll see that the blue is pre-survey and the orange is post-survey. And I mean, at first I was like, I was very disappointed because my post-survey results were actually lower than the pre-survey, not what I was anticipating at all. So it was very inconsistent with the research that I had done. But then I was thinking about, why did this happen? And really the reasons why I'm thinking is, within the environment that we're in, we had different, we had the simulation was very well designed, but we had different simulation instructors and the debriefing, and uncertain about that we in this whole process that was working in the simulation center had a really good understanding of the pedagogy of that. Also, we realized we'd have consistent incorporation of those best practice standards so that it is consistent amongst all educators. And in our planning process, there sometimes some parts in this, there's a lack of buy-in. And so I could not participate in the actual simulation or the debriefing. So I'm not sure if there was some deviation amongst those practices that were used. And because of that, some of the students left the experience actually more confused, and they questioned the knowledge they had. But then I realized that really reinforced kind of what other part in reading in the literature is, that students may have a good theoretical knowledge, but they're really not prepared to apply that knowledge when they're caring for patients. So for me, it just really enforced my belief and everything that, and not just my belief, but it's also literature supported, that we need to change our way we teach, the way our pedagogy, our methods, to consistently, so nurses can learn to apply their knowledge. Successful test taking does not determine competencies. These students who are, just because they pass state boards doesn't mean they're really competent, and research shows that. So what we really learned from this was the evidence-based project gave us a lot of insight on the implementation of simulation, and need to use the right standards and to implement them consistently to cultivate those outcomes that are desired. To identify a need for a process change, to also use not just the standards, but a clinical judgment model throughout the nursing education curricula, and further incorporate teaching strategies throughout the entire curriculum that promote application of knowledge. So in a nutshell, this poster is a little bit of a nutshell, because but it kind of, it was actually, like I said, at first it was disappointed with the results, but then I came out to really reinforce what we need to be doing in nursing education. And now that I've been in academia for 12 years, and now my current job, I am working with new nurses with nursing professional development. Part of my role is working with those new nurses, a nurse residency program, and to help to develop them through that first year as they transition into this role of nursing, which has been very challenging over obviously this past year has been very challenging. So that is my poster in a nutshell. So I'm open to any questions that anybody may have.
Dr. Glaza, will you be doing a follow-up study to this?
The plan was, when we did this study, so this all happened in February where we did the initial part, and the plan was to follow up with a cohort. So we would do it in the 6 month and then a year interval. But with COVID, we were unable to replicate any of that.
One of the things that comes to mind as the NCSBN is changing the format and the questions for
Right.
the NCLEX exam, they made the case that NCLEX really wasn't measuring critical thinking, it was just measuring basic competency.
Right.
And with the new formatting and new questions, they're focusing more on critical thinking, clinical reasoning, and clinical judgment. I think it would be interesting. I think they're rolling that out in 2023. It would be interesting to do a follow-up study to see, because obviously we're going to need to change how we do things in nursing education in order to better prepare the students. And that might have an impact on these findings in a more positive way.
I would think so. And when I look at the framework that they're using, so then the framework that's being used by the National Council State Board of Nursing is actually used Tanner's clinical judgment model, and they added on more components of that: nursing thinking and action, and having different things happen that the nurse is able to think. So it ties right in with it, which is actually kind of exciting when you think about where we're going with nursing education, and the possibilities that are ahead, but also identifying that as educators, we need to change the way we teach and on the way we're, because just teaching from a knowledge base is not working. We're seeing that, in the beginning in healthcare. I see it right now working with my new residents, and they really struggle putting some pieces together, and they want to learn more. They want you to do more sims. They want you to put them through different scenarios because they want to be able to, because it helps them to think. So I think there's a lot of opportunities that lie ahead with that.
It's an excellent poster presentation.